Welcome back. My name is Dr. Carl Baird, and today I'll be showing you the 6 best exercises for bone-on-bone knee arthritis. So if you're watching this video, it's probably because you've been to your doctor, they've taken an x-ray and told you that you have a very severe form of knee arthritis that they call bone-on-bone. And a lot of times they use this diagnosis to justify or move you in the direction of knee surgery. Now, it's hard to say whether that's going to be the best option for you because I don't know your case specifically, but my goal here on this page is to avoid surgery at all costs because there's a lot of side effects that come from these type of surgeries that they may not mention. So if there's a way to avoid the surgery, that is what we want. And a lot of times just building strength to support the knee is enough to help you maintain your lifestyle. For a lot of people, that's what they want. They just want to be able to climb stairs, continue to walk, nothing too crazy. And so what these exercises are going to do is help you build the strength to support your knee and remain functional and maintain your lifestyle as you get older. So let's go ahead and get started. The first exercise is the glute bridge. So one of the most important things you can do if you have knee pain, knee arthritis, bone-on-bone knee arthritis, is build strong glutes and hamstrings. These are muscles that are really important at protecting your knee, and the glute bridge is a very safe and very effective exercise at targeting those muscles. It doesn't put a lot of impact on your knee, so it's great for people that have this bone-on-bone knee arthritis. I'll go ahead and show you how to do it. You're going to start on your back. You want your feet about hip width apart, your arms just 45 degrees flat on the ground, and all you're going to do is press through your feet to lift your hips up, and you want to feel that tension in your glutes, in your hamstrings. If you're feeling it too much in your quads here, it's probably because your feet are too close to your hips and you're feeling a stretch along the front. If you're too far out with your feet, you might feel it more in the hamstrings there, which again, we want to target these glutes. So really taking the time to find that kind of middle ground where you press through those feet, raise the hips up, feel that tension in the glute, and back down. Another important muscle group to strengthen for anyone with knee pain or knee arthritis is this glute med, which is on the side of your hip. This is really important for supporting you when you're in a single leg stance to prevent that knee from caving inward, which is going to make that knee arthritis worse. So a great exercise for anyone with bone-on-bone knee arthritis is the clamshell. Again, this is a safe and effective way to target that muscle that doesn't put really any impact through the knee itself. So let's go ahead and show you how to perform. We're laying on our side. You can use your arm as a pillow here, and the knees will be out in front with your hips, knees, feet stacked. And then from there, all you're going to do, keeping the hips stacked, keeping the feet stacked, just lift that hip up and come back down. And again, what we're going for is this glute med, which is on the side of the hip right here. The only thing you really want to avoid with this exercise is lifting so high that you get this twisting in the lower back. We want to keep it just in the hip. And if this feels too easy, one thing that you can do is add a band around your knees just to add a little bit of extra resistance. And for most people, that's enough to really feel it in this glute med. As I mentioned in the beginning of this video, one of the main goals of anybody with bone-on-bone knee arthritis is just to remain functional. And one of the hardest things that people with this severe arthritis in the knees have is getting from a seated to a standing position. So this exercise is called the sit to stand, and it just mimics that movement to help you build strength to be able to perform that movement. So it's really easy. All you need is a chair or a box or something that you can sit on. You're going to start with your feet hip width apart. And again, the goal is to use your leg muscles to come from a sitting position to a standing position and then back to a sitting. So it's a really straightforward exercise. The only thing I would advise you not to do is get into the pattern of using your momentum to get you up. So what a lot of times people will do is they'll kind of lean back and then press up. Again, that's not using your muscles to get to the standing position. That's just using the momentum. So really start from a still position, press through your feet to come to that standing position and back down. There you have it. That's sit to stand. Another goal of a lot of people with bone-on-bone knee arthritis is to continue to be able to walk. This is just another one of those functional movements that we want to maintain even with that arthritis. And a great exercise to help with that is called the Dumbbell March, where you will need a weight for this one. All you're going to do is hold the weight right in front of you as close to your chest as possible. Stand nice and straight, and then you're just going to march in place. And the goal here is for it to be slow and controlled. If you can, you want to hold it for a quick second at the top to help improve your balance just a little bit. But if you're not able to do that, a lot of times I'll just have people start again. They have a hard time with the balance. Is just do nice and short little steps here. And then as you feel stronger and more comfortable in the movement, just trying to raise it up a little bit higher until you have that balance to really perform this slow, controlled with that second pause at the top. So there you have it. That is the Dumbbell March. The next exercise is a simple step up. So this is one of my favorite exercises for bone-on-bone knee arthritis because it strengthens the leg on a single side that helps correct any side-to-side imbalances. Again, if you just have one knee with bone-on-bone knee arthritis, there's probably an imbalance side-to-side. This can help correct it. It's also another functional movement. So most people with bone-on-bone knee arthritis have trouble climbing stairs, and this is going to help you build the strength to be able to complete that movement. So all you need is a step of some sort. I use this yoga block here. Again, lower height is going to be easier. I've had people just start on books and then work their way up. Taller step is going to be more difficult. But all you're going to do, start with one foot on top. You're going to use this top foot to press on the block to come to the standing position and back down. The only thing to watch out for here is that you're pressing up off of this top foot. A lot of times when people have pain in one knee, they try to cheat. Their body tries to cheat by toeing off on this back leg here, which is not what we want. We want to build strength in this top leg here. So that's the only thing to watch out for there. If you wanted to make it more challenging, again, you can use a higher step or you can add weight to each hand until you feel comfortable moving on to the next step. Another one of my favorite strength exercises for bone-on-bone knee arthritis is the elevated kettlebell lift. Now this is a full body strengthening exercise that primarily targets the glutes and the hamstrings, which if you'll remember is really important at protecting your knee. But it's also a really important movement pattern that helps protect your knee just as you move throughout your day. So it's kind of that double whammy, which is part of the reason I really like it. To perform, all you're going to need is a block and a weight. You can use the same dumbbell we used with the Dumbbell March as well. It doesn't have to be a kettlebell. You're going to start with your feet on the outside of the weight. So again, we're not standing too far back and reaching. That's going to hurt our lower back. We're going to start with our feet right on the outside. We're going to have loose knees and reach our hips back towards the wall behind us, just until we can reach that weight. And then from there, I'm pressing through the feet to stand back up and setting it down the same way I came down without the weight. Just sending the hips back till I can set it down and back up. So there you have it. That's 6 of the best strength exercises for anyone with bone-on-bone knee arthritis. And again, like I mentioned at the beginning of this video, I can't say whether surgery or exercise is going to be the best route for you individually, but what I can say is that these exercises are a great way to build strength to support your knee, keep active, and maintain your lifestyle as you get older, which for anyone with bone-on-bone knee arthritis is a great route to go. So give these a try. Let me know what you think. If you have any questions, leave them in the comments below. Hey guys, it's Dr. Carl Baird here, and I wanted to thank you for watching our previous video and supporting our channel. Now, if you're somebody who's looking to build strength to solve joint pain, keep active, and maintain your lifestyle as you get older, be sure to subscribe to our channel to watch all of our new videos. You won't find it anywhere else.